Welcome to this webinar on the highly topical and extremely important issue of rebuilding economies and tackling inequality in the post-COVID world. I'm Siobhan Benita, I'm a former UK civil servant, and I'm chairing this webinar on behalf of Global Government Forum, which serves civil servants all around the world. And I would also like to say a big thank you to our knowledge partners today, Deloitte and MasterCard, whose support means that we can offer this webinar to public servants free of charge. Now, just to set a bit of context before I introduce our wonderful panel today, since 2008 and the financial crisis, many countries around the world have experienced slow economic growth, stagnant incomes, and weakening job security. And these problems have had some really painful consequences, not least widening inequalities, social discord, and the rise of populist politics. And this year, with the arrival of COVID-19, the weakest in societies have been hit hardest. And the impacts of the pandemic threaten to exacerbate those existing financial, well-being, and health inequalities. So as countries seek to rebuild their economies in the wake of the pandemic, how can ministers and civil servants ensure that spending decisions and policies impact the most vulnerable and help the hardest hit? Today, we're going to consider the impacts of COVID-19, look at who has been affected, and discuss the policies, the public services, and the initiatives that can truly foster inclusive growth going forward. Now, in a moment, I will introduce our fantastic panel, and we have 5 really great experts with us today. Each panel member will give some opening remarks, but I also want to leave time for questions from all of you, the audience. And we have people with us today from countries all around the world. So I should have said at the beginning, a good morning, afternoon, or evening from wherever you're joining us from. So as much of today will depend on the great questions that you put forward to the panel as well. So please do, while you're listening to their opening remarks, you should have a Q&A function at the bottom of your screens. If you've got some questions you would like to put to our panel members, please do submit those using the Q&A function, and we will take as many of those questions as we can after the panelists have spoken. So now to our fantastic panel. First of all, we have Claire Moriarty, who's the former UK Permanent Secretary of the Department for the Environment, Food and Rural Affairs, and former head of the Department for Exiting the EU. Not an easy job at all. Claire's early career was spent mainly in the Department of Health and the NHS, but she's also held senior roles in the Ministry of Justice and the Department of Transport. Her current projects include chairing the Health Foundation's COVID-19 Impact Inquiry, which is exploring how inequalities have affected experience of the pandemic. Then we will hear from Stephanie Allen, who's Global Public Health and Social Services Leader for Deloitte. Now, Deloitte has the largest professional services healthcare practice in the world, and it's particularly recognized for the way in which it is integrating technologies to drive sustainable quality and cost improvements, and for its extensive clinical expertise working on contemporary models of care. Stephanie also leads the Health and Human Services practice for Australia, and she's joining us today from Australia, and is a consulting partner with over 25 years extensive experience in healthcare, both in the UK and Australia. Our third panel member today is Gus O'Donnell. Gus was the Cabinet Secretary and Head of the British Civil Service from 2005 to 2011. And in 2010, he oversaw the introduction of the first coalition government in the UK since the Second World War. Previously, he was Permanent Secretary of the Treasury from 2002 to 2005, and he also served on the IMF and the World Bank boards. Gus was appointed to the House of Lords in 2012, where he sits as a crossbencher. Gus currently has many hats, but including the Chairman of Frontier Economics, and chair of the Behavioural Insights Team Advisory Board at the Cabinet Office. Our fourth panel member is Jennifer Duncan. Jennifer is Vice President of the Government Innovation Global for MasterCard. Jennifer spent most of her career in government affairs and communications, She joined MasterCard in 2014 and in her current role focuses on addressing societal problems facing governments, the wider public sector and the citizens they serve, putting policy into practice. In 2020, Jennifer was named as the payment industry's emerging female leader. She's currently leading MasterCard's work with governments around the world to respond to the COVID-19 pandemic. And last but by no means least, we have Albin Kainalainen, who's Director General of Economic Affairs Department in the Ministry of Finance in Sweden. Albin is Director General at the moment, but he previously held different positions within the Swedish government offices, mainly working with fiscal policy frameworks. So as I said, we have a fantastic panel there today. I'm going to start now by asking Claire to give us her opening remarks. Claire, you might need to unmute.
Apologies, I momentarily lost my screen entirely. So I hope you can hear me now.
Yes, that's perfect. Thank you.
Thank you very much indeed. So I wanted to say a bit about the work that I'm involved in with the Health Foundation and just sort of point to where it might be going. So the Health Foundation inquiry is looking at the impact of COVID on the nation's health, but with a particular focus on inequalities. We're looking at the impact of the virus and of the measures to contain the virus. We're looking at the impact on health status directly and on the wider determinants of health. And we're looking at 3 time stamps. So how we were coming into the pandemic, what's happened during the pandemic, and then trying to look ahead to what that might tell us about recovery from the pandemic. I've got a few slides, but they're really more for the purposes of giving you a kind of visual sense of what I'm describing. I'm not going to talk through them in a lot of detail. So the first slide is starting with the pre-pandemic period, and this is taken from the Marmot 10 Years On report published by the Institute of Health Equity with the support of the Health Foundation. And what's striking is the change in the gradient of the graph. Mortality rates have been decreasing steadily over decades, but from 2010, they basically stalled. And for some groups, indeed, the position has gone backwards. It's a phenomenon that's been seen in other countries, but it is more marked in the UK than anywhere else apart from the US and Iceland. And that effect hasn't been spread evenly. So if we go on to the second slide, again, the thing to look for here is the gradient. So the blue gradient is overall life expectancy, but the steeper red gradient is people's healthy life expectancy. What that's telling us is that people in the most deprived groups are spending more of their shorter lives in ill health. Nearly around a third of people's lives are spent in ill health in the most deprived group, compared with under a fifth in the least deprived groups. So we went into the pandemic with low health resilience, and also, could I have the next slide, low economic and social resilience. So the gradient story here is actually almost the lack of gradient. So despite significant recovery since the financial crisis, lots of increase in the number of jobs, poverty, which is what the graph is showing, has not really shifted. And we know that 65% of low income families went into the pandemic with either no savings at all or savings under £1,500. And then the pandemic arrived, and the pandemic has also hit very unevenly across society. So if I could have the next slide, one of the areas we know is that it's been very unevenly spread according to people's occupational exposure. So people like bus drivers, taxi drivers, security guards, as well as frontline retail workers, pharmacists, as well as people working in the health and care sector, have seen mortality rates far greater than those in professional occupations. There's obviously links between people's occupation, their income, and their deprivation. So in the next slide, you can see another of those gradients, which are becoming depressingly familiar. So much greater mortality among people in the most deprived groups than in the least deprived groups. And that's the impact of mortality from the virus itself. On the next slide, you can see an impact on employment. And people in the bottom quintile have seen a much greater impact on employment from the measures to contain the spread of the virus than those in the top quintile. So what we're seeing is impact piling upon impact for the most disadvantaged in society. And then on the last slide, just picking up one of the other areas that's been much talked about, which is the differential impact for people from some minority ethnic groups. We know that the mortality rates for people from Black communities is over 4 times what it's been for white communities. Some of that is explained by factors like comorbidities, like the housing conditions that people live in, the fact that more people are in situations where they've got, where they're exposed to more of the virus. So that accounts to some of it, but there's still an unexplained 2 times mortality factor. And in reality, even the bits that we can explain are things which are themselves the result of structural inequalities and racism. We know that children and young people have been disproportionately affected by the virus and its impact, the impact that there's been on education, on employment. Young people have been twice as likely to lose their jobs as working age adults. And we also know that disabled people have seen mortality rates that are 1.5 to twice as high as those for non-disabled people. So what we've seen across the whole of the impact of the pandemic has been that it's widened existing inequalities. So, you know, stark message, we went into the virus with a high level of inequality, and in pretty much every area that we can measure, the impact of the virus has then been to make that greater. So as we come on to looking at the recovery, you know, we have to start from the perspective of addressing inequality. If we go through a recovery of the type that we went through after the financial crisis, we're just going to see a widening of those inequalities. That is the central message of the Marmot 10 Years On report. And we know that countries with greater income inequality also have lower health and social status. So these are problems which compound. So you have, you know, greater inequalities leads to lower resilience, leads to worse impacts of something like the pandemic, leads to greater inequalities. This is a vicious circle, and we have to use this opportunity as we plan the recovery from this pandemic to break that cycle and really to focus on inequalities. That's partly about choosing the types of measures that address issues that really look at the, you know, the way in which we have to deliver on the promises of, you know, addressing the educational impact, which has been particularly hard for some groups of people. We have to think about digital inclusion. But the thought I wanted to leave on was really about a related question, which is how we get away from the dichotomy of thinking about health and economy as things which are almost in opposition to each other. All the way through the pandemic, we've heard people talking about kind of saving lives versus saving the economy. We know from the experience of the countries who've handled the pandemic best that actually those two things are not in opposition. Countries who've seen the least number of deaths have also seen the least impact on the economy. And we have to think about ways we get beyond, we really embed the idea that a healthy economy depends on a healthy population, and a healthy population depends on a healthy economy. When I worked in the Department for Environment, one of the things that we found was that there was a tendency for people to see the environment as a drag on the economy. So if we did things which were good for the environment, that was perceived as being bad for the economy. And we know that's not true. Doing things that are good for the environment, if you take a sufficiently broad and long-term view, is also making a difference to the economy. And one of the ways we addressed that was by creating a concept called natural capital, which was a way of really valuing nature so that it could be put into decision making in a way that people could deal with. And I think there's a real opportunity to think about how we do the same sort of thing for health. Some countries are starting to do it already. New Zealand's made quite a bit of progress on that. Scotland has introduced some measures of that kind. And just at the end of last week, the Office for National Statistics published the very first edition of a health index, which takes a variety of measures around health and thinking about what is the impact on the health of the population of particular measures. I think that's an enormously important development, and one which if we can put that at the centre of our thinking about recovering the economy, then we stand a chance of improving health and reducing inequality.
Fantastic. Thank you so much, Claire. That was a great introduction. Really good to set the scene there with the statistics. Interesting to look at. I know this is UK specific, the data you gave, but I'm pretty sure it'll be similar for other countries around the world as well in terms of the impact. But very interesting from the UK's perspective to look at how we went into this pandemic and what some of those structural inequalities already were. And I think some of the things that you mentioned there in terms of going forward, how we can tackle these digital inclusion, education, valuing health, valuing the environment in different ways, will be themes that we hear picked up by our other panel members. So thank you so much for that. Stephanie, I'm going to come to you now.
Thank you very much. So where I'm going to take the conversation next is to really build on what Claire has spoken about and talk about some of the shifts that we were already seeing in healthcare pre-COVID and how they have been accelerated through COVID, but also to point out that a number of these shifts have the propensity to either increase or decrease inequality. And so my overriding message would be we need to be very cognizant and thoughtful and considered when we're thinking about government policy going forward in these areas. So I'm going to talk about these 10 shifts very quickly and then come to the key considerations. So healthcare across the world has moved from very much a volume-based system to a value-based system. And what we mean by that is rather than counting the inputs into healthcare, how many hip replacements, knee replacements, whatever it is that we have delivered, what value, what meaningful value that has delivered to patients. So the ability to walk without pain, the ability to walk your dog, the ability to be independent and remain living at home. So that shift from volume to value. We've also seen a shift in most health economies from thinking about the patient as passive recipients of care to customers or consumers, where we now are starting to see patients really become knowledgeable and take charge of some of their healthcare decisions and choices that they are being enabled to make. One of the major shifts that we saw within COVID is moving from really bricks and mortar delivery, so delivering healthcare largely within GP clinics or hospitals, to using the Internet of Things or virtual care delivery models to start delivering care to people's homes or to wherever they choose to receive that care. Now that's going to be really important in terms of health inequality. So in the past, when we were reliant on bricks and mortar, you'd have a large-scale tertiary or quaternary hospital, often based in a city. But actually servicing those rural and remote populations, or servicing those populations that didn't feel comfortable accessing the services in the way that we had designed them, or enabling frail elderly individuals to receive access to care without having to travel, has been and will be enabled through COVID if we continue to focus on virtual care delivery, but to do so in a much more robust and industrial way rather than just telehealth consultations. One of the other trends that we started to see as well pre-COVID was this idea that in the past, the healthcare system has really been set up as a sickness system, where we really assess people when they are ill or they've had a catastrophic event like a car accident, to actually really trying to support and monitor them to remain well. So that's where we get a lot of the prevention coming through. Now, throughout COVID, I think there's been a sea change in the way that policy has started to be thought about. So population health has come very strongly up the agenda. And the idea that as citizens, we have to take responsibility for our wellness, as well as the healthcare system supporting us in that endeavour. So I think we'll see that trend continuing as well. One of the other things that has come through, again, very strongly is this idea that in the past, our healthcare system was very much set up around acute needs or acute illness, and recognising that for the vast majority of healthcare systems across the world, actually what we're dealing with is chronic illness. And those chronic underlying comorbidities that Claire mentioned will absolutely increase the risk profile of those individuals through COVID and also through the vaccination process. So there's a couple of key considerations that I wouldn't mind just highlighting. When we look across the world, the healthcare systems that have actually fared better are those that have both public and private elements to them. And that's because it gave capacity and the ability to scale up when it was necessary. Most healthcare systems across the world do have that flavour of public and private, and that's certainly something that I know a number of governments around the world are looking to see what that relative balance is going to be going forward. I think one of the other considerations that has come through very strongly is health and society is everybody's business. So to Claire's point, when we look at people who are unhealthy or unwell, they often have a whole variety of social determinants of health. So whether that's poverty, inability to access healthy food, education, employment, stable housing, it is a compounding effect that actually delivers true well-being. What we're starting to see as well through COVID is the role of disruptive technology, and no more so in the area of mental health or mental well-being. So in an environment where we have struggled to get enough healthcare workers because they've either suffered themselves from being infected or indeed just the demand on them has been tremendous, we're starting to see technology and disruptive technology play a really central and important role in the delivery of healthcare. And so, for example, we know that in areas of mental health, it is often, if it's done appropriately, clinically efficacious to talk to, for example, a chatbot than it is to talk to a speaking therapist, whether that's a psychologist, psychiatrist, or cognitive behavioural worker. And so there are alternatives that are coming through the system that can actually provide different levels of accessibility to different groups than previously we would have experienced. The last thing I'll end on, and this is something that I'm hugely passionate about, is that tackling inequality in a COVID environment requires us to be really transparent around some of the decisions that we're making, and using a decision-making framework where, when we're faced with that complexity, we can always go back to and say, what was it that we are trying to achieve? And so I know that a number of governments around the world, particularly when they're dealing with the mental health demands that have come through COVID, are looking at ethical frameworks to really guide their actions and decisions around how and what is appropriate. And I think that for government policy, actually understanding what ethical framework that you're using and being transparent around your decision making is going to be really important going forward. So I'll leave you with that, Siobhan.
Thank you so much, Stephanie. Again, that's a really good way to build on what Claire was saying as well, in terms of how kind of health systems around the world were already changing, some of the trends there, but how COVID has kind of highlighted and maybe sped up some of those transformations, some of those changes as well. Really interesting how strongly a focus on mental health and well-being has come out already from the first two panel members, and I think we'll probably hear more from that. And also, I think, though, everything that you said there, which I think the whole point of today's conversation is about, is what does this mean for the policy decisions and the spending decisions that governments are going to have to take if they want to embrace some of these changes going forward. Gus, I'm going to come to you now.
Thank you very much. And I thought the first two speakers were really interesting, and I want to try and build on what they've said. But first of all, I think it's important to create the bigger picture. Throughout my career, both at the IMF, the World Bank, and in the UK civil service, the basic story was that things were getting better. There was significant progress in terms of standard economic measures like GDP, but in terms of life expectancy, healthy life expectancy, as one of Claire's charts showed, in terms of rights, and all those sorts of issues, where the world was getting a better place. And the story behind this was that there's a rising tide and it's floating all boats, and we don't need to worry too much about inequality because everyone's getting better off, and they're absolutely getting better off, and they're living longer. Look at the massive reduction in poverty in China, for example. Now that story is no longer true, and it hasn't been true for quite a while. And I think the works of a Nobel Prize-winning economist, Angus Deaton, Professor Deaton, shows you that. He wrote this book called The Great Escape, which basically explained this great progress and the escape from poverty. But his latest book, written with his partner Anne Case, is called The Deaths of Despair. And it's basically looking at American data, the rise in suicides and opioid deaths. And it's a fascinating read. But it does point out the fact that the American dream has gone, that actually inequality has been increasing. And as economies have slowed down in growth, more and more attention is being focused on those being left behind. A lot of work as well, particularly in the States, but more globally, has been done by Carol Graham at Brookings, looking at the specifics. And Claire looked at the different ethnic minority effects. And one of the things that Carol has specified is that this absence of hope in society is actually quite interesting, and that it's quite one of the groups that really, really does badly is poor whites. And you can associate this as well with the strong vote for President Trump. And there's quite a lot of complexity there that we need to look at. So that's the kind of bigger picture. The point I would raise as well, given the focus of the first two parts, and remember we're talking about rebuilding economies and tackling inequality, is that we need to think about the relationship between health and well-being. And I might come back to this later, but they're not the same thing, right? Let's be absolutely clear. You can be in perfect physical and mental health, but actually be having a terrible time. Usually the two go hand in hand, but it's worth noting they're slightly different. Now let's come on to COVID, and let me go to my first slide. Here, this shows you basically what I mean when I talk about well-being is that the work that I've done with Richard Layard and with Angus Deaton in the past, there are basically 4 questions we ask people about. How satisfied are you with your life? Do you feel your life is worthwhile? And then some actually what we call more instantaneous questions about your level of happiness and your level of anxiety. Obviously, we want anxiety to be as low as possible. And what you'll see there is that in the UK, they're moving along quite stably, and then the COVID period hits, and people's satisfaction with their life, how worthwhile they feel it is, their happiness, all plummets, and their anxiety levels rise. And these are big effects, pretty much unprecedented for the time series we have. This data we started to collect with very large samples in the UK during 2011. One of the things I'm quite proud of doing, and I'm sure David Cameron is prouder of that than some of his other features during his time. So that's what's happening to well-being. And you know, if you look at what's behind that, so moving on to the next slide, forget about the international ones. I won't have time to cover all of those. But when we look at the distributional impacts, and this picks up in somewhat more detail some of the things that Claire was talking about. Why is it that there's been this difference between genders and across different groups in terms of the distributional impact? Well, there you see that basically, surprise, surprise, women end up getting the real brunt of the childcare. They also end up doing more housework, and actually the dads pretend to be doing paid work. So, you've got this increasing basically gender inequality. Now, if we move on to the next slide, you'll see, so what's happening as we look at the age distribution? Well, it's the young people who are being hit by the lockdown measures. We know about how, and Claire put up some slides about the impact of COVID on different groups. I mean, we know that actually age is probably the most important factor, actually. And the older you are, the more likely you are to die of COVID, and that's quite dramatic. But if you look at here at what we've done in terms of the measures to try and control COVID, the lockdowns, the share of employees in shutdown sectors, under 25s and women. So we're basically, it's the young females who are being hit most by these measures which are being used to tackle the virus. And that's the focus is pretty much true in lots of countries around the world. And it's quite dramatic. So you can see the impact on the young in work there, but also if you look at, if I would show you things about schools, obviously schools have been shut a lot. That will affect the impact of people, of those generations for many, many years to come, their educational drawbacks. And the Institute of Fiscal Studies in the UK has done a lot more work on that. Again, I won't get into it. What I would say is that what's really unusual about the COVID crisis is that this is what I call a mixed crisis. So it starts off, and SAGE in the UK started off full of epidemiologists and medics, right? But actually the way we're trying to handle it is by behavior changes. So lockdowns are there to induce behavior changes to reduce transmission. It's all about behavior change. Unfortunately, we kind of didn't get this mixed bit to start with. So we were very dominated by the scientists and not enough by what I would call the social scientists. They need to actually look at the impact of these measures and to do some kind of sensible cost benefit for us. So I think that's been part of the problem, and it's something that I looked at in more detail in a lecture for the FS, and it's in an article which is coming out in Fiscal Studies, the December issue. If we move on now to the next slide, that shows you even more impact what's happening to this in terms of how highly you're paid. So those in the lowest paid professions are much more likely to be shut down. We know that that's retail, that's hospitality, that's things like that. So we are damaging the income distribution as well. It's poor people who are being affected most by this. And that is one reason why this has completely worked against the levelling up agenda that the government has. So if we now move on to the next slide, so how does a wellbeing approach help here? Well, what I'd say is, when you look at the determinants of very low well-being and you want to reduce inequality of well-being, the things you need to go through, mental health is massive, right? So if you're looking at what governments can do, the practical things they could do is spend a lot more on mental health. You would not leave people with physical injuries untreated, and yet we do it all the time with mental health. Secondly, good jobs. It's massively important to be in a job. That's great for your self-esteem and things like that. We need to do that. Thirdly, income at the low end. You need to think about how do you look at minimum wages and things like that. Fourthly, public spending. We need to move public spending towards prevention, not cure, towards all of those health things. Stephanie was talking about having a health service that kind of values the outcomes. And I love that idea. Nigel Crisp, who was head of our NHS some time back, wrote this book about, and the phrase is, health is made at home, hospitals are for repairs. And I think that's right. We need to get a behavioral approach to health that actually helps people for the longer term. And one of the lessons we need to get from this, and why building back better has to be done in the right way, and this is the last thought I'll leave you with, is we need to learn the lessons from this crisis about what worked and what didn't. And in particular, where was our contingency planning? You know, we went into this, as people have said, with the health service in a bad state, with inequalities in a bad state, and all of our contingency planning had somehow got led astray. The PPE stocks, which I left behind when I left as Cabinet Secretary, seem to have been used up. So we need to think about how do we do really good contingency planning and make sure that it's not, as it were, all the funds that have been put aside aren't used for something else in the interim. And for example, if you look at climate change, you know, we need to be thinking about how do we actually approach that, do some contingency planning, and also do some real work, which might actually lower people's well-being in the short term, but improve their well-being in the longer term. And one big lesson from all of this, I think, is we need to think carefully as a society about what we value. I won't have time to go into that in great detail, but I'll just say, if you get a chance, listen to the Reith lectures that Mark Carney is putting out at the moment about how society values things. I think we've realized during this lockdown that there are certain things that we value enormously. Hugs, kisses, meeting people we know, none of that is in GDP, right? So the idea of GDP as a success measure, forget it. Success is really about overall living a great life, a satisfying life, and lots of well-being. And with that, I'm afraid my time is up, so I shall have to hand back to Siobhan.
Thank you so much, Gus. Again, brilliant insight there. I think I really like the learning lessons, not just from this crisis, which is obviously going to be really important, but also looking back. So as you said, like for years, that kind of growing inequality, increasing inequality, the absence of hope, and what's that led to in terms of the kind of politics that we have as well at the moment, and can we not keep repeating some of those mistakes? But you set the challenge there of what things ministers need to be thinking about going forward, so spending more on, which is what Stephanie said also, on things like mental health, on well-being, on ensuring that we have good, secure jobs. We'll come back to the income things. There's lots to talk about UBI, things like that as well going around. I think there are mixed thoughts on that. But also I think that's a really difficult challenge for ministers when they're talking about growth, when they have to make really hard decisions about where they're spending public money. What do we value as a society? And that's a very different approach, I think, for a lot of ministers. Thank you so much for that. Jennifer, I'm going to hand over to you now.
Fantastic. Thanks, Siobhan. So many interesting things. It's going to be hard for me to stay on track and try and respond to so many of the points that have been made. But I think just grabbing onto the point that was made about hope and optimism, I think many of you today probably woke up to the news that in the UK, the first people were receiving the vaccination. And I think for the first time in a long time, there was positivity, there was, you know, hope for the future. And I think that's something I want to try and pull through into the discussion. And I want to focus on the point that actually our conversation topic for today is, you know, rebuilding economies and tackling inequality in a post-COVID world. Some of the examples I want to share with you are about how governments have been tackling this issue in their response to COVID. One of the key things that we have seen, which has not been prioritised previously, is an acceleration around financial digital inclusion. This is something the UN have championed for many, many years, but there has been a very slow uptake and focus on this area. Now, if I take a region like Latin America, you have 45% of that population are not digitally financially included. When the pandemic hit, how do you reach those individuals when they needed welfare support, financial assistance? Actually, they turned to digital. And during this period of addressing the COVID-19 pandemic, actually, we've seen the largest scale programs of financial inclusion driven by governments than we've ever seen before. And actually, the challenge is going to be, how do we ensure that that's not seen as solely a crisis measure? That is an imperative for our economy and how we move forward. We've seen lots of groups brought into the financial system that were thought that were to be tricky and hard to address. I think both Claire and Gus and Stephanie all talked about, for example, older people. We've seen governments, for example, in Chile and in Israel, focus their energies on actually digitizing things like pensions and providing those individuals with the financial tools they needed to stay at home and protect their health, but at the same time enabling them to be self-sufficient. providing capability, and actually those skills also enabled them to boost their well-being. So being digitally enabled allowed them to interact with their grandchildren, with their family, while staying at home. Now, there's lots of examples I can give you in terms of the interventions that were made by governments. I think we've been engaged in over 100 different initiatives in 40 different countries in face of the pandemic. But there's one area I think we should all consider focusing on to try and avoid some of the consequences that we've heard from the previous panelists, and that is how to create that economic stability. And SMEs would be the one area that I would ask you all to consider when looking at your recovery plans. They employ 50% of the people globally, and they provide over half of GDP. They are hugely important to people's livelihoods. But during the pandemic, in just 3 months, we saw 1 in 5 of those businesses shut their doors. We need to have a huge focus on how we ensure that SMEs continue to support people. Now, again, there have been a number of governments who've already taken action in this space. If I think, for example, about Ireland, pre-COVID, they already had a programme that recognised the benefits that digitisation could bring for their economy. They have an initiative called I'll get it wrong now, the Digital Trading Voucher Online Scheme. But what that did was offer an initial fund to help overcome the capital outlay of digitising. Now, that investment is a worthwhile investment for the government, because what they heard from those businesses was that 35% saw an increase in employment as a consequence, 20% saw an increase in their sales, and 3 in 5 exported for the first time. If we're going to take any steps to try and protect the economy, to allow people to move forward and have those employment opportunities to protect their well-being, SME has to be a good place to start. Now, as I said, there's many examples that we could cover today, but I think I'm just going to leave it there and say that I would ask you to consider in your recovery plans how to channel digital financial inclusion as an imperative, and how you help small businesses not just to recover, but to thrive.
Great, thank you so much, Jennifer, bringing in another aspect there. It was actually Support Small Business Day, I think, yesterday in the United Kingdom. So there were lots of ministers out and about doing selfies with small businesses, but a really serious point that they have been hugely impacted by the pandemic, small businesses, and that has to be a central part of the recovery going forward. But again, I think there's lots, we can probably pick up on this in the discussion afterwards, the idea of how governments have been forced to look at putting a lot of their public services online, digital, because of the pandemic. But is that something then that they can continue to do afterwards? And also, is there a risk though that those services aren't accessible to everybody? You might be creating some other kind of barriers there to inclusion. So I think that's an important point for us to pick up in the discussion afterwards. I'm going to come to Albin now. Just a reminder to people who are watching, please do post any questions that you've had. We've had fantastic contributions already. Please do post any questions that you've got in the Q&A, because I'll be coming to those shortly after Albin. Albin, over to you now.
Thank you very much, and thank you for the opportunity to give the Swedish view. I'm actually serving as a civil servant right now, so my ability to speak freely, of course, a bit limited compared to my other colleagues, and I might come in also with another perspective, given that I currently work in the Ministry of Finance. So I will give you a Ministry of Finance perspective in these issues. So I will talk about 2 issues. Foremost, the experience in Sweden during the COVID crisis, or handling the crisis when it comes to inequality, and some words of more forward-looking. When it comes to the experience we have had so far, many of my colleagues here has been from the UK. So compared to the UK, we have had as bad health situation, and unfortunately as many deaths in comparison as the UK. But we have a much, our GDP will decrease by around 3% this year. Our public finances will only have deficits around 3% maybe also. So we see a very different picture from the UK. So what were we trying to do when we ended up in this situation in February and March? We, as many other countries, tried to freeze the economy, and I come back to why that's important later for the future. This means that we try to avoid separations from employment into unemployment. We try to preserve the business structure as much as we could. We use the same kind of measures as practically all other countries, Western countries, used when it comes to short-term working schemes and some different transfers to some sectors that were particularly hardly hit. One thing that Sweden did early was to decide that schools should be kept open to the largest extent possible. We saw that this would give long-term positive effects. But what we didn't really expect was that stock markets would continue to move upwards rather than downwards, that housing prices would continue to move upwards rather rapidly, as they have done in practically all Western countries. This, of course, gives wealth effects in this crisis that we have not seen in previous crises. So what we are seeing is even all the measures taken, we see that unemployment is increasing. We see a more evenly distributed unemployment increase between groups than we have seen in, for example, the UK. But of course, the weakest groups are gaining most in unemployment rates. And what we have tried to do this crisis, as we try to do in all crises, is to keep unemployed in the labor force, which is very important to us. So we see positive signs when unemployment is increasing in this kind of crisis. We would be much more worried if labor force participation decreased. So increased employment can be a positive sign. So, but if we're looking a bit forward, I would say a few words that might sound a bit dull, but I worked in the ministry also after the great financial crisis, and I saw quite the same discussions then that you should use this to do a different kind of restart of the economy, which didn't really happen. Of course, the experience now we have learned from the financial crisis, so we might not do the same mistakes that we did then, especially when it comes to doing fiscal tightening too early in the crisis. But there are also things that complicates to making a different kind of restart. I would say primarily is, since countries took the method of freezing the economy, the unfreeze will be within same structures, and you will want to get people into employment as fast as possible. I think that speed here will be prioritized before quality, but I might be wrong there. We also have transformation lags. If you want to re-educate people and move them into different sectors and different jobs, that takes time. And we have in most countries real difficulties in quickly adopting different education policies. Universities are very slow and conservative. They are not really institutions built to mass educate and swiftly change between different types of education. We have a lack of teachers in most countries in the world, and especially teachers if you want to re-educate into blue collar professions that are highly in demand. There's always a lack of teachers in those professions. And we have a public finance issue. Of course, we must learn from the last crisis when we tightened the economy too early. But debt levels in many countries are now very, very high. Deficits can't go on in the 5 to 10% levels. There need to be some return into lower deficits. You don't probably need to go to surpluses, of course, but debt will also, of course, be a large hinder to making very swift steps to another kind of economy. If you can't do reprioritizations at the same time, which of course is very difficult. So a bit dull, but of course a lot of things can be done, but it's not easy, and I think that the political system will prioritize speed before quality when it comes to increasing employment after a crisis. Thank you.
Thank you so much, Albin. It was inevitable, I think, having you on the panel from Sweden, where the comparison between the Swedish approach to dealing with the pandemic and other countries would be really interesting. I think you've really highlighted there some of the decisions that ministers took, going back to what Claire said about how you balance kind of health against the economy, and you saw a different approach in Sweden from the start. But I wanted to have you at the end of the panel today, so I think it's really important what you said there at the end about the reality for governments and for ministers in terms of building back better. So the speed at which you can change an approach, the speed at which you can do the training and the skilling into new sectors, like you say, universities, institutions like that, not necessarily the most pacey in terms of bringing about that change, but also just that reality of the financial situation. So high levels of debt and the need for governments to get their deficits down, that's a huge challenge for policymakers, for ministers going forward when you're trying to bring in transformational change. So thank you so much to all our panel members. We have had a couple of questions come in, so I'm going to actually turn to those because they're very similar to what I wanted to ask, especially the first question. So this has come in from Femke Jansen, so I might not be doing that justice, but here's the question, which is, I strongly agree about the fact that governments need to focus on prevention, so well-being, jobs, education, exactly, etc. But what about social security institutions? Will governments also have to focus more on creating a safety net for its citizens? And which evolution should happen in this area? And I wanted to add to that, as I mentioned, that there's quite a bit of talk around things like a universal basic income and what do people think about that. I'm going to change the order a bit. I'm going to come to Gus first, if you would like to kick off with your thoughts on that.
Certainly, and it's a very good question, because we will need to think about this as we come through the rebuilding stage. You know, what changes are actually structural and will be relatively permanent, and what ones are temporary. And I strongly agree that we may well get governments looking for speed, not quality, as they build back. In terms of social security institutions and things like universal basic income, I don't have a nuanced position on this. I think universal basic income is an extremely bad idea. And I look at that from a well-being point of view. I think what people are forgetting is that jobs are much more than just income. I mean, income is massively important, but jobs are massively important as well. When you think of job giving you self-esteem, it's giving you skills, it's giving you colleagues, it does so many things that to just say, no, sit back and we'll give you some money. And we know the scarring effects of unemployment, that as people say, without jobs, their ability to get a job goes down every week. It gets worse. And the impacts on their mental health eventually get a lot worse. So the last thing you want is to have people, is to basically say a job's just neither here nor there, here's your universal basic income. So I really wouldn't go down that route. But we do need to think about, during this transition, are our unemployment pay good enough. I mean, we have some crazy things about our social sector institutions. If you compare, say, the UK with Singapore, if you ask people to quarantine, particularly low-income people, there's a real issue for them because they'll not go into work, they won't get paid. In Singapore, they paid them. Curiously enough, they obeyed the quarantine rules. Now, Singapore has a history of obeying quarantine rules, but, you know, when we're doing this elsewhere and we're not paying people, surprise, surprise, the incentive effects means they don't obey the quarantine rules. That's happening all over the place. So we need to be smart about these things. And we need to think about how can our social sector institutions, our benefits system, really work on reskilling. Alvin's absolutely right that there has been a big change in fiscal attitudes. You know, we now believe, not like Maastricht criteria or stability and growth patterns, but we believe that we can actually run big deficits and big debt for longer, particularly with interest rates at approximately zero. But eventually we'll need to start paying these back. We don't need to do that too soon, but we need to think then about possibilities of things like one-off taxes for those who've actually, COVID has been a complete boon. In the UK, we've seen a lot of our retailers giving back government money, which I think is absolutely admirable. But there are lots of other sectors who've had big windfall gains, and governments need to think about what they might do about those if they aren't reinvested to help the recovery.
Thanks, Gus. Stephanie, did you have any thoughts on this question?
So where I'd like to go in this question is actually where Gus was going earlier in the discussion, is that I think we've focused a lot, and governments have focused a lot around structural changes that are needed to support citizens, and particularly those vulnerable populations, through COVID. But what he said, which really resonated with me, is that we need to get behavioural economics front and centre. So when we think about homeless people or people with drug and alcohol addictions or people in overcrowded housing or all of those vulnerable groups that we know have been made more vulnerable through this crisis, we have to motivate them to do the right thing in the moment. And I think understanding personal behavioural economics is going to be really the next frontier of how we really need to face into this crisis in a meaningful way, to support and encourage people to make the best choices that they can in the situations that they find themselves in.
It's interesting. I just want to thank you for that, because we just had another question coming in, which asks, so do your government, this is from Joseph Trailer, and it says, do your governments incentivise health and wellbeing behaviour within any programme? So do they factor in things like behavioural economics? And so I'm from the US, where we are predominantly private health insurance, and some companies' health plans provide discounts or rebates if people meet X amounts of steps per day, for example. I'm curious how European governments who have public health care are approaching this one. So I'm going to add that into the mix and ask Claire, do you want to either answer the question around kind of a social security blanket, a support blanket for people, or any examples of where people are using kind of behavioural economics as incentives?
Thank you. So, I mean, just to pick up a few points. I mean, I think to go back to the original question, you know, the kind of the what about social security institutions, and do we need to look at them as part of trying to make a shift towards greater focus on prevention? I mean, I think we undoubtedly need to think about them as part of the package. I mean, there are, as Gus was saying, you know, there are clearly all sorts of difficulties about universal basic income, but equally we can't follow down the logic of saying, you know, the important thing is for people to have jobs, and, you know, any job is good, because that's kind of what we've seen since the financial crisis, that there have been plenty of jobs, but the jobs haven't been good quality jobs. And I think you know, the point that again that Gus made earlier about the prevailing idea previously that as long as the economy was growing, then that was going to be okay, and we didn't need to worry about inequalities, and really kind of GDP was so much the central measure. And I think what we do know from the experience of the last 10 years is that looking at GDP on its own isn't enough. One of the interesting concepts I came across the other day was the idea of a K-shaped recovery. So we've talked about V-shaped and U-shaped, but I mean the idea of a K-shaped recovery is, broadly speaking, the kind of the financial markets recovering strongly, but actually the real economy, people's real experience, actually not getting better. And that obviously translates into things improving for the people who already have it good, like us, and not improving for the people who have been suffered the rough end of inequalities, and therefore the rough end of the pandemic. So I think we've got to be really careful. I mean, ideally what we would need to do is look holistically across all of these various factors. Income is important, jobs are important, people's early life experiences are important. We've got whole sectors which we systematically devalue, where people are paid low wages to do work which is actually of incredible importance for the future of the nation, whether that's people working in social care or people working in early years. Also some of our lowest paid sectors are where the most important things are being done. So I think we do have to think about, and social security is part of that package. I mean, I think specifically on the behavioural incentives, I think in this country we have a bit of a love-hate relationship. We are, I think, more advanced in our use of behavioural insights and behavioural economic nudges than most other countries, and certainly looking at what we do versus what happens in other parts of Europe, my impression was always that we were very focused on behavioural insights, but then we run up against the kind of we're worried about becoming a nanny state. So we give people encouragement to do things, but we don't necessarily follow through. So I think all the right messages are out there, and there's some quite sophisticated thinking about how we get people to do things, but they do run up at some point against a nervousness about doing things which appear to be nanny telling you what you can and can't do.
Thank you. Thanks, Claire. Albin, your thoughts on, you mentioned already in your presentation how Sweden had used the benefit system, but do you think there'll be more of that going forward in terms of maybe raising minimum wage, that kind of thing? And any examples that you have of kind of behavioural economics being used now in a different approach to policy making?
No, I would say that Sweden, to a very small extent, uses behavioral economics in our. The discussions always end up that it's easy to use measures that encourage people to take that to the end and say that you shouldn't get healthcare if you don't walk 10,000 steps a day. It's very difficult for a state to have as a policy. So. I can say a few words on the universal basic income. I would say that, adding to that Gus said, I would say that it also requires trust in a society level, which is very difficult to have if you don't have strong demands to work or incentives to work in benefit systems. You can't have trust, and you don't get acceptance of those systems. So. And we are not currently planning any major changes. We have rather high remuneration levels compared to other countries, and rather among the highest minimum wages. So I don't see any changes there.
Thanks very much. Jennifer, I'm going to come to you. You're already working with governments around the world. So have you seen any examples of where nudges are being used to help kind of the take up of new initiatives, but also your thoughts on things like maybe a hiring of the minimum wage or universal basic income? Any thoughts on that?
Yeah, thanks, Siobhan. I think I would pick up on the points made by Gus about the universal basic income, and I guess what's the output that you're trying to get from that? I think Claire touched on this as well about employability and well-being. Actually, some of the governments are thinking beyond giving funds and actually what those funds can be used for. So I've heard one suggestion that the universal basic income should be a lump rather than a regular payment to enable people, for example, to start businesses Or we've seen other governments, like in Indonesia, their intervention for the people who had become unemployed due to COVID, they had two elements to their back to work program. In fact, the card that they used is called the pre-work card when it translates. So there was unemployment support, but actually the second phase of payment to those individuals was around training and helping them get the skills that they need to find new employment. Also, we see France using technology to think about how they can reskill individuals and fit with employment that potentially they've had before. So they're using things like AI to deal with their skills. It's like a skills bank account, shall I say. I don't know what the exact terminology that they use is, but basically annually, each citizen gets money towards their training. And what they found is obviously you're moving about from different jobs. They want that budget to go with people and actually for them to utilise it to get skills to enable them to find new employment. So I think the recent example that was shared with us was around a chef who had become unemployed, and actually they had analysed the fact that he had chemistry experience, and believe it or not, he's now in discussions about a job in the pharmaceuticals industry because of skills that he had from a previous job, but they used actually data analytics to find that route for him to move forward into the new economy. So it's that's those sort of, I guess, pragmatic approaches about how you help people access and rethink about the skills and training that they need to succeed in the digital economy.
Great, thank you. I'm really conscious of the time, how time flies when we're having such a good discussion. So I'm going to take two questions, and then the panel members can decide which one they answer when I come to them. So the first one, I'm not going to read out the whole question, but I think the gist of it is that they were pleased to hear this. This is from Brad Bass. He was pleased to hear panel members mentioning things that we all value, which maybe haven't been picked up in GDP, traditional GDP measurements before. And Brad is asking, do any of the panel members know of any valuations of the damage caused by COVID that have included the loss of goods, services and activities that are not traditionally included in GDP? So are we actually looking at the impact on those things at the moment? That's one. And the other question is around, so Jennifer talked about the role of SMEs and how important they're going to be in the recovery. Does anybody have any thoughts on what governments can do? So actual tangible things governments can do to help SMEs going forward. That's coming from Sanjay. So let me go to Stephanie. Would you like to have a go either on impacts of things we value, or how do we help SMEs going forward?
So in terms of Australia, I'll talk about some of the work that we've been doing with SMEs. So I guess when we looked beyond the data at the impact of COVID on SMEs, we realised that it was multifactorial. So not only were they potentially losing their business because of obviously a loss of trade or having to close down their operations, it also had a significant impact on their sense of identity. A lot of them were private ownership, and their sense of pride, obviously, in the work that they'd built up over many years. We actually had a number of those SME owners ringing their banks to ask for refinancing, but actually in doing so, identifying suicide ideation. And so there was a point where some of the major Australian banks and the call centre operators were then having to mobilise emergency services to go around to these individuals' houses because of what had happened. So Australia did actually have a very deep focus on SME and how that they could support those businesses, both from a financial perspective, but also from a well-being or perspective to enable them to move forward. So some of that was around proactive reach out and access to support and services. Others were financial incentive schemes. And what we're now starting to do is to do some predictive analytics. So the other thing that's been quite significant for Australia is actually understanding what of those businesses were successful pre-COVID and actually need to continue and are a really important part of the economy going forward. Which of those businesses were essentially failing even pre-COVID and are not necessarily some of the sectors that we want to focus on going forward. Now, that doesn't mean that the support is different to those groups, but actually really understanding what we need to rebuild our economy really quickly has given us some important insight.
Great, thank you very much, Stephanie. Albin, is this something, SMEs, is this something that's very high on the agenda in Sweden, or the impacts of things that aren't traditionally calculated in the value system?
Yes, I mean, as an economist, I would love to see measures that are broader than GDP. So such work is, I think it's ongoing on different, but I haven't seen any concrete results yet. And when it comes to SMEs, of course, from a policy perspective, it's very desirable to get on, but we try to work a lot there with general measures. I mean, the general tax system, and not try to subsidize or do special rules for different kind of company structures. But of course, I think the political will is to make more reforms ahead to acknowledge the large role of small and mid-sized enterprises.
Thanks so much. Jennifer, I'm going to come to you. You obviously focus on this and were inspiration for this question. What more would you like to see governments doing to help SMEs going forward?
I think actually tackle the point that not all SMEs are equal. So one of the trends that we've seen is when you look at OECD data, actually women are more deeply affected by the pandemic than their male counterparts. So in 63% of countries, actually female unemployment rates are much greater. So one of the things that we've done as an organisation is commit to focusing on trying to support 25 million female-led entrepreneurs digitise and grow their business. And I think Gus made the very clear case for the impacts on women in terms of the workloads at home and the various downstream consequences for them. I think we do need some specific policies to ensure that women continue to be able to contribute to the economy and boost their well-being.
Thanks very much. Yeah, I think the slide that Gus showed on the percentage of work that women do should be the "Tell me something I don't know" slide. I think watching this event. Claire, I'm going to come to you now. Anything you would like to add either on kind of how we value those different things or on how we support small businesses?
Well, let me say a quick word about how we value things, because this was very much the point that I was driving at when talking about how we've got to get beyond GDP. It's a really, really important measure, but it just is not the totality of everything in life. And you know, health and well-being, hugely important. The environment, hugely important. And I think it comes back to this idea about developing a multiple sense of different types of capital. So I was talked about the work in New Zealand where they talk about 4 capitals. So there's financial and physical capital, which is broadly pretty well reflected in GDP, natural capital, and then human and social capital. And you know, natural capital will measure the impact that COVID has on the environment through a variety of kind of direct and indirect routes. You know, there was that kind of lovely period when you know, air quality improved because people weren't driving around so much, but actually now it's come back up again. So there are ways of measuring things like that. And the human and social capital, and I mentioned the Office for National Statistics Health Index, that has 3 domains: people, places, and lives, and you know, does really have the ability to capture an awful lot of what happens as a result of things like, I mean, not just the loss of access to some of the health services, regular treatments, a huge reduction in referrals for cancer treatment, but also, you know, the way that people are living their lives. So I think that's a broader measure. It'll be very interesting to see how it interacts with some of the existing measures for well-being. And we can, you know, and economists can put financial values on quality adjusted life years, on various measures of health. So once you've got a way of tracking if things are going up and down, then you can then start to measure what the impact is. And I really do think that we could make a huge difference by taking a step towards the idea of GDP as one important measure, but not the only way in which we measure the impact.
Thanks, Claire. I know we are almost out of time, but Gus, I'm going to come to you for your thoughts on this as well. I know this is something you care about a lot.
Yes, magnificently. So as I started my life as an academic economist, just to be absolutely clear, GDP is not a success measure. It's an activity measure, right? It goes up when bad things happen, like earthquakes, because you build more houses, right? If all the volunteers in the world gave up volunteering and took up prostitution, GDP goes up, not down. So it's a really interesting thing for economists on activity, not success. Success really requires us to think about what kind of society we like. I would do it by actually how people feel about their lives. So direct well-being measures like the ONS4 questions. And you can then go on to do something called well-being years, which is actually development of QALYs, because actually there are technical things wrong with QALYs, but well-being years, and we've used this to look at the framework that you should use for looking at something like the lockdown. And we picked up, as Claire said, the air quality gains there were, for example, and we put valuations on them in terms of how much did that make people feel better. So you can do all of these things. One of the other things is volunteering, and volunteering went up enormously at the start of the first lockdown. It hasn't gone up anything like as much in the second lockdown. But if you look at the government messaging, we wanted people to volunteer. We wanted that to happen. And yet we were saying, keep your social distance. We still are, which is a really stupid thing to say, right? Let's be clear about this. If you know anything about behavioral economics, you would have said, actually what you want to make is physical distancing and social togetherness. So if there's any lesson that people get from this is talk to your behavioral people about your messaging and get it right. And yeah, we can do, and people have. I've got an article on the BMJ about using wellbeing years as an alternative measure of success for a society. And if we can do that, then that will be enormously better, rather than this rather silly activity measure, which is very useful for all sorts of things, but not actually how far are we succeeding.
Brilliant, thank you. I'm so sorry that we have run out of time. We couldn't get through all the questions. There were questions coming in. I think it's really interesting, for me, a very positive thing that the topic was about rebuilding economies and tackling inequalities, and lots of the focus today has been on what do we really value going forward. But I think it's also interesting and a kind of tough reality check for us. Albin's challenges about, we might all want that, but what's the reality for ministers and policymakers going forward? And there are significant challenges ahead, I think. I would like to say a huge thank you to all of our fantastic panel members for all of your time today. To Gus, to Stephanie, Claire, Albin and Jennifer, thank you so much. A thanks again to our knowledge partners, Deloitte and MasterCard, for supporting this event today. And finally, to everybody who has joined us watching. We had lots of people on the line from all around the world today. And if you want to watch it again, which I'm sure you do, there will be a video of this coming out very soon, and there will be a write-up as well. So you will get more chance to see this and to share it with your colleagues as well. But for now, goodbye to everybody, and I wish you a happy festive season if we don't see you again for Christmas, and enjoy the rest of the day wherever you are. Thank you, everyone. Thank you.
Thanks.
Thanks, Siobhan. Well chaired.
Bye.
All the best.